Gather all equipments to save time, effort, and energy. Check the temperature to determine baby's temperature. Undress the baby and wrap using mommy restraint to prevent unnecessary movement. Hold the baby like a football hold in your left arm and supporting at the back of the neck and head. And your right hand is used to soap, rinse, and dry the scalp. A football hold is to prevent babies from from falling. Mm, then fold the outer ears with your thumb and your middle finger to prevent water entering to the air that may cause air infection. And wash first the head with the soap and water, then rinse. Mild soap are prevents to harmful effects to the skin. Use like lactacid or perla. Then um, and then and rinse, then dry the head to prevent chilling. Then with your clean thumb, wipes the baby's eye from inner canthus to outer canthus. Start from the farther side, then the nearer side. Then wipe the face of the baby from the forehead to chin with CEC motion from the further side and then the nearer side. Then pat dry and place the baby on the crib. Remove the diaper. Any fecal matters remove with tissue paper before washing. And place the baby on the bathtub and shoulder supporting. Bring the baby on the bathtub and supporting the shoulders and with one hand and tucking your fingers under his armpit and uh, support the legs or buttocks with the other hand to prevent injury. And then wet the entire body and then soap the anterior body starting from the neck to abdomen in circular motion, and then proceed to the arms. Start from the axilla to rest from the farther side, then the nearer side. Then wash hands without soap and with soap and proceed to the lower extremities, starting from the groin farther side down to the foot, then the other side, then rinse and then turn the baby on his back and soap and wash the buttocks and genitals are last area to be clean, and rinse and then bring the baby on the crib and dry the entire body, and dress the infant a t-shirt and then diaper and then following by the other clothes to provide warmth, and comb the hair if needed, and then do cord dressing. Gather all equipments to save time, effort, and energy. Then drop refined alcohol to the baby's umbilicus to soften the drained blood, can easily remove discharges. And then soak the cotton project or cotton buds with refined alcohol, and then clean the umbilical cord with cotton project or cotton buds to remove debris. And then clean the umbilical cord from inner to outer portion of the cord. Clean the umbilical cord in circular motion from inner to outer portion of the cord, and repeat the procedure until the cord is thoroughly clean to prevent infection. And then drop refined alcohol to the baby's umbilicus by avoiding dripping of solution to the genitalia or circumcision area to create discomfort for the baby. And dry the umbilical cord by open dressing to facilitate drying and healing of the cord, and then remove the cord clamp after 48 hours. And then position the baby on his stomach. Position the infant on his stomach on right side lying position. The positioning facilitate movement of the food, and facilitating digestion, and prevents regurgitating of food.